Hi, I'm Dr. Jonathan Manieri, and today we're just going to talk about why it's so incredibly expensive for healthcare in the United States. And there's one reason why. And you can, these politicians, whether they're talking about Obamacare, Trump care, whatever care, they're not addressing the issue. The main issue with healthcare costs has to do with competition, like anything else in any other industry. If you have low competition, okay, you're going to have high prices. All right. If you have high competition, it's going to drive the prices down. So the reason we have no competition, and you'll see in these videos, these ghost calls that, where I call different urgent cares, you can see that there's no upfront pricing. You have no idea what it could cost you. So a lot of people have high deductibles like myself, $7,500 deductible. And you just have no idea what it's going to cost to go into these doctor's office, as you'll see in these calls that I make. I have a $7,500 deductible. I was just wondering if I came in, how much it would cost to maybe get some meds and an x-ray.
What insurance do you have?
I have Blue Cross, but I'm just wondering if it's cheaper to pay cash, if you have any self-pay rates.
So for a deductible plan with Blue Cross, we would ask $45 up front, and then you would just be billed for the remainder towards your deductible from your insurance after the fact.
Is there?
The 45.
Do you know how much that would cost for the additional charges beyond the 45?
So I can't tell you what that would be because we would have to purchase it through your insurance.
Now, if I was going to pay cash, is it maybe cheaper to pay?
So it's $130 just to be seen, and then for X-ray it'd be additional, and then if they have, depending on what else they have to do, there could be additional costs.
Okay, so do you know how much the X-rays are?
So let me see here. So depending on what they have to do,
Yeah.
it's kind of hard to say because it's kind of up to the provider at that point on what she needs to have done.
Okay. All right.
A couple different types of X-rays, different locations and things, then you may have to pay more.
Okay. All right. Super. Well, that was helpful. And thanks for your time.
Yeah, no problem. You have a good day.
Okay.
Bye-bye. How may I help you?
Hi. I just wanted to talk to see how much it would cost to come in and, maybe get an X-ray, maybe, because I don't have any insurance. I just wanted to see kind of the cost on that.
How we would handle a self-pay patient is we would just request a $250 deposit, and that would just go towards your emergency room visit. And then it would depend on what kind of testing was needed, as far as what our physician would need to order to,
Like an X-ray. Do you know how much an X-ray would cost?
We don't have specific charges. So as far as an X-ray, because then that X-ray would need to be read by the radiologist. So we're not, we don't have any kind of base pricing.
Wow. Okay.
It's just a standard ER visit, and then...
Okay. Do you know what a standard ER visit costs? Or
I'm sorry?
Oh, do you know what a standard ER visit costs? Just, for back pain or...
It would vary. Like I said, it would depend on what kind of testing would need to be required for your, to determine your diagnosis.
I'm just trying to think ballpark, maybe... When we send out an X-ray, if you pay cash, the facility we use $60, and that includes the read-off by a certified radiologist. So just upfront pricing. So yeah.
That would be emergent. Now, emergent self-pay would be it's $250 plus whatever services are done with it. So for it's individual services with that.
Okay, so like what kind of services? Like a medication or something?
No, like you're saying if they draw your blood.
Oh, okay. So that would be
Yeah.
it'd be 250 plus the 175.
No, the 175 is just for the urgent care.
Okay.
Yeah.
So I'm just trying to get ballpark how much it may cost me. Do you think it would be under 1,000 or?
Well, I don't think they're gonna. I don't know. You know, the doctor is the one that determines.
Right.
They'll triage you and be like, okay, well, look, I think this is what we need to do. And I mean, at that point, you can either say, no, I'd rather just do that. You know what I'm saying? If you don't want to have your blood drawn and it become an emergent visit, you can just not do that. You know?
Okay. Yeah, because then the price may crank up a little bit.
Right. So if it's just urgent care, if it's just an urgent care visit, it's $175, and that would include your visit and if they do x-rays. Now, if it's emergent care, like if they have to draw your blood, it's $250 plus whatever services they do with that.
Okay.
Okay.
All right. Okay. Well, I appreciate your help.
All right, no problem.
Okay. Take care.
Thanks, you too. Bye.
Because urgent care prices are capped at a small, because that's what the law is. But if you create an urgent care that's also an emergency room, they're not going to do surgery or the stuff like a hospital, but they can charge you crazy prices like this person. No idea the ridiculous pricing. This is the lady talking of this place. Daughter had an asthma situation. A little asthma attack. 2 nebulizer treatments, a mask with some medication, 90 minutes, $6,200. Woo! And so goes on. Never go to an emergency room like this. Didn't know it was an emergency room. They have you sign a contract, no transparent pricing up front. They should have you sign, so you have no idea. You have no idea what they're going to charge you. I can't imagine they're moral gougers who can stand to work there. Should be a Colorado law requiring upfront estimate. I've been saying this for years. Upfront pricing. They say, well, we can't do it because we need to do all these procedures. Every other industry does it. Do package pricing. Super simple. They don't want to do it because they know they're price gouging and they're making billions of dollars. Have to have upfront pricing for packages. You come in for this condition, this is what it's going to cost you. That includes everything. The medication, the x-ray, the blood work. Very simple. Don't want to do it. No upfront pricing. $6,200. If someone's, has a high deductible, how are you going to afford that? How are you going to budget for that? Here's another one. 20 minutes, a Band-Aid. And now they're saying I owe them $1,000. They bill separately the facility charges and the physician portion. So that, remember, upcoding. They're charging you for all these unknown things. You have no idea. The physician bill was $650. That's $1,300 an hour. They were there for 20 minutes. They didn't even get any stitches. Here's another one. Patients be aware. Patients be aware. Worst emergency room under the sun. They will bankrupt you. Nasty poisonous snakes. It goes on and on, these reviews about no upfront pricing, have no idea. And if you don't pay their bill, if you go to court or they send you to court, the judge is like, you had this service. You paid that $100,000 bill. That's what you owe. So really need to change. We've got some good solutions. It goes on. This is the hospital that we have locally here. I'm not going to name names, but we've had patients with bills of over $120,000 for 3 nights. I mean, just crazy, astronomical, out of control, totally bankrupting people. And no one wants to talk about this is what's healthcare, the cost. So now the solution. We're going to talk about solutions. You already know what it's going to be about, upfront pricing. So when someone calls my office, how much is it going to cost for first visit? $50. Staff can tell, boom, right away. That includes everything, the exam, the computerized nerve test, orthopedic test, and a treatment. That wasn't that hard. I can do that. How much for acupuncture? $85. Exam and treatment. How much for a massage? $70. That wasn't that hard. It's been made to be so complicated, and it doesn't need to be. I mean, they can have a price sheet right there with, boom, this is what we've got, introductory examination, including x-rays, including labs. We have a package price, $150. So simple. Process faster. People know exactly what they're going to get, what they need to do. That's the only way. Otherwise, people have no idea what the bill is. Okay, it could be $150 or $130, like she said, minimally, or it could be $1,000. There's just no way to budget that. 60% of all healthcare costs come from doctor's visits and hospital visits, okay? So that's whether you're seeing a specialist or you're having a procedure, colonoscopy or whatever, primary care visit, going into the hospital, that's 60%. That's huge. That's a lot of money. And so you're that industry has zero competition, meaning that there's no prices up front. So that's the only way to lower competition, is to have upfront pricing. We're going to get into that a little bit more. The other thing is that the number one reason people file for bankruptcy is because of medical bills. I mean, that is ridiculous. That's the number one reason people are losing their houses, filing for bankruptcy, is because there's no upfront pricing. And these politicians don't want to talk about that. They're trying to create all these, well, we're going to tweak this plan, this bill. It's going to help lower insurance premiums and doctor visits. No, it's not. No, it's not. That's not going to address the issue. You know, they don't want to talk about the real issue, which is prices, all right? Or they just don't know. Because I've treated politicians before. I've treated a senator before. His insurance, and I'm not going to name names, but when he came into our clinic, he was ticked off because he had a 20% co-insurance for massage. He had no deductible, no copay for everything else. The chiropractor, everything else was covered at 100%. So these guys that are making these plans, and gals, they have no idea what's going on. They're not in the trenches. They don't want to talk about, because listen, the reason there's no competition, it's not because of the doctors and nurses. Those are good people. We want to help people. It's the people above, the executives of the hospitals, these large corporations that do not want any competition. Trust me, they do not. They want to keep the bills vague. They want you to come in and say, well, you know, it depends on what the doctor recommends. We'll send a bill into the mail to you. That's the craziest thing. That's the most idiotic system, that there's no upfront pricing. Let's say, for an example, and all Americans have to do this, if you're a middle class person, you got a budget to buy a car, and your budget is $30,000. And you go to a dealership, you find a car that's reasonably priced, you make a deal for $30,000, but they say, wait a second, well, we're not sure what the price of this car right now. What we're going to do is we're going to send you a bill, and that bill could be anywhere from $25,000 to $85,000. You would never buy that car. How are you going to budget? How are you going to budget anything like that? That's the most idiotic thing. That a consumer has no idea when they go into a hospital or a doctor's visit that it could be $100 or $10,000. That's why everyone's so scared. I have a lot of patients that are completely scared to go in to see a provider because they have no idea what it's going to cost. So people aren't getting health care. As the deductibles go higher and there's no upfront pricing, all-inclusive pricing, they have no idea. There's no competition. So, and if you don't pay that bill, what does the hospital or doctor's office do to you? They send you to collections, or they garnish your wages, they trash your credit. For 40 years, included, myself included, is that we've been billing, when you bill to an insurance company, you bill based on procedures that are done. Those CPT codes that are used to bill procedures. So if you go to the hospital, they can bill for just your time lying in the hospital. That's a CPT code. If you get any medication, another CPT code. If you use a tissue, CPT code. If you use water, have a drink of water. If they, put a catheter, that's another. So they code, and there could be 50 codes if you're in the hospital. So that's how they make their money. It's called coding or upcoding. They code to the highest level. And a lot of patients have no idea what they're being charged from. The nurse doesn't say when you're in there, hey, by the way, this you just use that water, that's going to be $50. That tissue over there is $25. You just laid in this bed for 3 hours, that's an additional $1,000. The doctor's going to come and visit you tonight, that's going to be additional $1,000. So they don't do that with you, which they should. They should before anything's done. Any business, when you take your car in, let's say your car to something's wrong with it, they say, okay, well, it's going to be $80 just to look at it. Then they let you know, as you know, you go to the dealership and they tell you there's 20 different things wrong with your car and how much it's going to cost. That would be kind of nice, wouldn't it, if you went into a doctor's office or a hospital and say, listen, I just want to let you know that this is what it's going to cost. What would you like to do? Because you could get a $30,000 bill in the mail. So upfront pricing, we do, every other industry has it. And a lot of people in the healthcare industry, well, it's too complicated. Well, you can't do that. You can't pre-package prices or have all-inclusive pricing per visit. Who says you can't do that? We could totally do that. It's very easy. Say, you know what, the doctor to look at you today is going to be $80. A blood work is going to be $300, and an x-ray is going to be $100. What would you like to do? That's fine, but do they do that? No. Okay, so we have to have that kind of upfront pricing so people can make better decisions about their health. It has to be online, okay? And what they have to do, and I'm trying to get Congress to do this, but these politicians are not listening, so I'm actually trying to talk to Amazon about having a healthcare provider, whole healthcare site to Amazon, where you can list, let's say that you want to go in and you have a child that has asthma, wants to be seen. You can see 30 doctors, what they charge for a visit, pre-packaged price, all-inclusive, and their reviews. Super simple. So that's the only way out. Then you can compare and see, okay, this doctor's got great reviews, pre-packaged price to see them, $100, includes the medication, includes a visit. That way we can make a better decision about our health. And that competition will lower prices. That's what Amazon has done. Okay, that's why Sports Authority and Target and Sears and JCPenney's, all of them are getting beat up because competition is forcing them to lower their prices. That's the only way out of this. You can't create any kind of Trump care, Obamacare, all these politicians. That's not going to lower price. Has to do with competition, upfront pricing. You can have these upfront pricings at hospitals and doctor's visits where they can offer you prepackaged pricing. If we can see that online on a website like Amazon where you can make better choices and budget. The whole thing is being able to budget so you don't go into bankruptcy. That's the only way out of this. As these providers and hospitals, as they see more and more doctors getting online and looking at their rates, you'll see those prices going way down. That's what happened with Amazon, with all the other products they sell. Then we're going to get to a point where you're going to start to see, and we already have one here, a surgery center where they do all-inclusive pricing, like gallbladder surgery, $3,200. That's if you have a high deductible and you want to pay out of pocket. That includes everything, the anesthesiologist, the surgery center, the doctor, super high quality places. So you're going to see these facilities start, and they're going to do prepackaged pricing, all-inclusive pricing for different procedures. That's the only way out, is to have this competition. What I would recommend doing is that just getting the word out. I would still hit your local politicians, say, the only way to lower, and you can forward this video, the only way to lower prices is through increased competition, upfront pricing online where people can make choices. with patient outcomes with their reviews about that doctor. Okay, that's the only way to do it. They're not going to be able to twist, so we need to have either federally, they force to have, be super simple, upfront pricing. It's not going to cost a doctor's office anything more to have their prices online. How hard is that? Boom, put up prices, okay, prepackaged prices if you want to pay out of pocket. You know, well, you're forcing the government to do something. No, I'm not. We're all forced to give upfront pricing. A lot of industries have that. You know, where it's auto, or there's a lot of regulation says you need to tell the customer what it's going to cost. That's pretty simple. That's pretty simple. That's not asking for a lot. You could give whatever, you know, you give their highest price you want. Just put something on the website so that we can start to at least see what upfront pricing is. If they do that, they don't want to do this, it will start to lower prices because other doctors, other hospitals are going to look at, well, this hospital's charging this, we may need to lower our price a little bit. Oh, well, there, you'll start to see that. So talk to your politicians, request upfront pricing in any healthcare bill. Has to be done. Super important, so they understand that this is the only way out of this. If we don't do this, what's going to happen is that it's going to stay the same. Premiums for insurance are going to go way out, deductibles will go higher, and more people are going to file bankruptcy, and it will bankrupt the country. There's just no competition. What will happen too, this is really interesting, is that with insurance companies, it will actually lower their premiums. You'll see your premiums go way down as there's increased competition, because this is the other thing. There's local corporations that are buying up hospitals, primary physician's office, surgery centers. And there's two huge ones in Denver right now. And they own hospitals. They're all inclusive in this corporation. So it will enable those large corporations to be an insurance provider locally. So you won't have to go through Blue Cross, Cigna, Aetna, United Healthcare, the big guys. You'll actually be insured by a local corporation where everything's in-house, like a Kaiser. And so they'll start to compete with these large insurance companies, and the large insurance companies are going to have to bring their premium down. Because they can say, okay, well, Sutter Health or whoever's local, Health One, they're offering a all-inclusive plan for families for $6,000 a year or $3,000 a year. That includes their doctor's visits for a year, blood work, checkups, everything. Everything's going to come down. Prices will come down as we have those online upfront pricing on a website. It has to do with competition. Just look at Amazon. If you have any questions or comments, post it in this video, whether it's a positive review or it's a trolley comment, I don't care. You can also subscribe. Check out our other videos on how to lower cholesterol. Our anti-inflammatory ebook video will also be in this description. Check that out if you want to get on these high deductible plans and boost your health. That's important. You're doing the juicing and all this anti-inflammatory foods, all right? So I hope this was helpful. We're going to do other videos about Medicare, Medicaid, and the biggie prescription drugs soon. We'll see you in the next video.